The medical education model that agencies have been using for decades just officially died. And if you're still pitching hour-long webinars to pharma clients, you're about to become irrelevant. Let's look at the data that's reshaping how we reach healthcare professionals. For years, medical education followed the academic conference model. Hour-long presentations, detailed slide decks, comprehensive modules. The assumption was that doctors wanted deep, thorough education because they're, well, doctors. But something fundamental has shifted in physician behavior that's breaking this entire approach. According to new research from Healthcasts media, over 70% of physicians are now using mobile devices for professional content consumption. But here's the kicker. They've completely lost patience for traditional formats. One medical excellence manager put it perfectly. Doctors have no patience for 30-minute or 1-hour webinars anymore unless there's a super important international keynote speaker. We're seeing a massive shift toward 5 to 10-minute content formats. Physicians want information they can consume between patients, during lunch breaks, or while commuting. They're treating medical education like social media. Quick, digestible, actionable. This fundamentally breaks the traditional medical education model that agencies have been selling for decades. Comprehensive webinar series or an hour-long educational modules are now worthless. Here's what's really happening. Physicians are overwhelmed with information. They're seeing more patients in less time, dealing with more administrative burden, and trying to stay current on rapidly evolving medical knowledge. They don't have time for your beautifully crafted 60-minute presentation. This shift is being driven by 3 factors. First, mobile consumption habits that mirror consumer behavior. Second, time constraints that are getting worse, not better. Third, attention spans that have been trained by social media to expect quick, valuable content. For agency teams, this means completely rethinking content architecture. Instead of 1 hour-long webinar, think 10 5-minute modules. Instead of comprehensive slide decks, think mobile-optimized infographics. Instead of traditional CME formats, think microlearning that can be consumed on demand. For client-side medical affairs teams, your education budgets need to shift toward mobile-first, bite-sized content creation. The agencies that understand this shift will win your business. The ones still pitching traditional formats will get left behind. Creative teams need to start thinking like TikTok creators, not academic publishers. How do you deliver complex medical information in a format that respects physicians' time and attention spans? If this kind of healthcare marketing intelligence is valuable to you, hit that subscribe button and drop a comment with your biggest challenge in reaching HCPs. Follow Breaking Pharma for weekly insights that keep healthcare advertising professionals ahead of industry shifts.